So basically, the study we presented is about molecular imaging in prostate cancer. Recently, there have been a lot of changes in our management with the arrival of a new molecular imaging category of tracer, which binds to the PSMA tracer. However, the accuracy of these tracers to detect prostate cancer at very low level are not that well described. And another very important point for the clinical application of these tracer is how do they change the management of our patient that have prostate cancer. So many years ago, the CONDOR study was designed to answer two main questions. First, what is the accuracy of PSMA imaging with the DCF-PYL, which is one of those tracers, and also to see how does that imaging, PET imaging with DCF-PYL would change the management of the patient. So the CONDOR study is a multi-center prospective study that was done many years ago in centers in Canada and US. And it accrued more than 200 men, and all the PET scans that were done in this patient were blinded readed. Okay, so basically, the patient to be included in that study had to have undergone either radical prostatectomy or radiation therapy for prostate cancer and have PSA recurrence. Basically, this is a study that is prospective, multi-center, that was not randomized but because it's single-armed, and it's a study that was done in patients that underwent radical prostatectomy or radiation therapy, and then that had PSA recurrence after these primary tumor treatment. The patient had to have normal or equivocal imaging, and then they would have this investigational molecular imaging modality, the DCF-PYL PET scan. The physician had a questionnaire to fill about their management before the imaging and after to see if there was a change in management. The CONDOR study was published already, so the key findings were that the accuracy of the DCF-PYL was very high at about 85% in terms of positive predictive value, and there was a change in management in 63% of patients. However, today, what is new, what we presented, is that this imaging modality could change also the management in patients at very low PSA level. That was a question that was not fully answered, and certainly not in a prospective multicenter study with blinded readers. So what we show is that in the patient that has a change in management and that had a low PSA level below 0.5, the DCF-PYL change management, in fact, in 39% of patients. So that's a lot of patients. And the change in management was mostly due to a positive PET scan found during the trial. So basically, it answers the question that the PSMA PET-CT is useful not only in patients that have a PSA above 1 or at higher level of PSA, but also at PSAs that are very low and still low enough to get salvage therapies. PSMA has been shown clearly to be superior to conventional imaging in many studies, but we have to fit it in our clinical practice. And one of the key questions we had is that can we really use it at low PSA level, low enough to give radiation therapy to our patient after a radical prostatectomy? And it seems that the impact of DCF-PYL, PSMA PET-CT is important, very important at low PSA level. So there is an indication and a role for this imaging at low PSA level, and that will influence the clinician about the intensification of treatment that they will provide their patient or change in their management. So I think that DCF-PYL and PSMA PET-CT now is established as a superior modality than conventional imaging. We can use it in recurrent prostate cancer, both after a radical prostatectomy and radiation therapy. And even if we do it at very low PSA level, we might have findings that will change our management and maybe improve patient care.